Thank you, Madam Chairwoman. As a new member of Congress and a former small business owner, just 5 months ago, I listened to your stories actually with envy in some ways. I miss my small business, and I miss being part of that, and I think you all do what you do because you love, being a small business owner. And when I came here, or when I was running, someone said, well, politics is not for the faint of heart. I think being a small business owner is not for the faint of heart. So I want to thank you for all you do, and thank you for your testimony. I'm very proud to recognize your monumental achievements today, and that this is the 46th Annual National Small Business Week. And I'm pleased that this committee has invited you heroes of the small businesses to testify here today. One of the issues I want to ask the panel to just address as a whole is health care. This is a debate that we are just beginning, and we need your input. I know as the person in our small business who made those tough decisions every year about our health care plan for our employees, and one employee gets sick and all of a sudden your premiums go up 24%, and how can we continue to sustain this? And many small businesses can't, and then have had to unfortunately drop coverage for their employees, and none of us, I think, want to do that. From what I hear from you and what I did as an employer was treat my employees as my family. And so you don't want to do that to your employees. But if I could ask your opinion, maybe on a couple issues, maybe individual mandates. Do we need to mandate that everyone have some kind of health insurance coverage? What about issues of price transparency, of being able to actually look at your service and compare price across procedures, doctors, hospitals, or anything else you might want to share specifically on our health care debate as we go forward? So I'll start with Dr. Pachowski, please.
Yes, we just really view that as part of the compensation package, and it's part of the way we attract employees. So we shop around for health care. We have a decent pool. We used to be members of a high-tech council. We've gotten big enough where now we have a big enough pool of employees where we can shop for health care and provide it to our employees as a benefit. So yeah, it's getting expensive. We have to be very careful where we get it from, but it is part of the total compensation package. It's part of how we attract our employees and keep our employees. So.
And do you think everyone should be mandated to be covered?
Well, who's going to pay for it then? I mean, I don't know how that's going to work if that's the case. I know if there's a mandate and everybody can get health insurance from somewhere, why would we then offer health insurance? It'd probably be the first thing that a company would do.
Okay, so you see it just as an advantage to your company over others to attract.
It's just part of the compensation package. I don't know if it's advantage over anybody else, but it's part of what you have to pay an employee to come work for you. And if you want to keep a good employee, you give them good health insurance and make that part of your compensation package.
Okay. Ms. McCain?
I think any company that could afford to pay the premium would certainly offer their employees health insurance. Now, we offer Blue Cross health insurance and dental insurance. We find that our employees expect this of us, and we're glad we can do it. The first years we was in business, pay for it. We pay half the premium, whether it's single coverage or family coverage. The company absorbs half of it, and we're glad to do this.
Mr. Farr?
We just see it as a cost of doing business. If there was some sort of mandate that every business had to provide that, I think you'd see a lot of small businesses go out of business. But, on the other hand, a small child in a inner city area, they need to have that. So it's kind of a who pays the bill? Do the businesses pay the bill, or does the government pay the bill?
Right now, everybody's paying about $1,000 a year for all the people that aren't insured. But, we are paying for it. I'm just curious, because I know I struggle with this as a small business owner, just where your feelings are on this, because it is a debate that's going to happen this summer.
In terms of mandatory requirement on small business, that would not be responded to with well by Missouri small business owners. The recurrent theme that I hear is control costs and get access to pools of, insurance pools particularly for the company that maybe only has 5 people or 10 people in it. There's a recurrent frustration. I know there are both market-oriented ways and governmentally sponsored ways to accomplish that. I haven't heard business owners talk in any detail about that, but pooling and cost control are the two things that I hear.
Ms. Brown?
Well, we're a union shop and we're a large shop and we have incredible health care. We take care of everyone across the board, and that's not an option. It's not really an issue, honestly. It is part, as everyone has said, kind of the whole package. So we pay a huge amount for that, but that's part of what we do for the skilled workforce. I would say we would echo that, of course, we want to control costs. Of course, the way it's at now, it's a huge issue for the unions and for a lot of other folks across the board. And, obviously price transparency, I believe that's probably a good thing as well. But for us, yeah, that's...
Time is expired, but I would allow for the other members of the panel to respond very briefly. We're going to have votes in the House in a minute, so I would like to recognize the gentleman, Mr. Schroeder. But if you have, any of you wants to comment.
May I make a quick
Sure.
comment, please? Radically different. Yes, we do a 70-30 split, but quite frankly, my opinion is it's none of my business. It should be a consumer item that they buy. I do not believe it should be provided by employers. And I'm a simplistic thinker. You'll have to forgive me. I don't pay for their car insurance, their home insurance. It shouldn't be medical. And when my employee walks through the hospital door to the ER, it doesn't cost my employee any more than the IBM employee or somebody else. I don't understand why our system is that way. It shouldn't be.
I have a brief comment, if you
Yes.
don't mind. We have a unique perspective on health care. We are self-insured. Our health program is self-insured, and we take great strides in preventative health care. We also offer it to our seasonal employees as a staff benefit to help improve our retention. So at this point, it is, I think we're okay.
Okay, thank you.
Just one brief comment. Just if you allow us to pool the companies, so my industry, if we were able to pool together,
That's my legislation,
perfect, 3,000,
so that we could spread the risk
absolutely, and that would reduce our premium.
negotiate the premiums. Yes. Mr.